Welcome all for the today's class. So we continue with our epidemiology module and the study designs which we have started. We have finished a couple of study designs like cohort study. We have finished cross-sectional. We have studied finished. Now we will start with case control study today. Okay, so how the studies we have divided? The studies are divided into two. One is an observational, second is an experimental. Okay, it depends on the investigator assigning the intervention. Okay, because in an observational study, the investigator does not assign any intervention to any of the group. Okay, where the exposure is happening naturally, while here the exposure or the assignment is done by the researcher. Okay, so that fits into the experimental category, while in observational the exposure is happening naturally. Okay, this researcher is only observing it. Okay, so in experimental category we have randomized control trial, while in observational we have further two types. One is a descriptive and second is analytical. So in descriptive we have the case series, and in analytical we have cohort and cross sectional, which we have finished in the last session, and today we will finish with the case control. So case control is actually observational analytical type of study. So case control is an observational analytical study. Okay, so we start with today's topic of case control. So it's an analytical observational study in which participants are selected based on their status and previous exposure is then assessed. So participants are selected based on the disease status. That means disease present or disease absent, they are selected, and then the previous exposure is then assessed. So here it is going from outcome to the exposure. Okay, so it is going in a backward direction. Okay, which is exactly in contrast to the cohort study. Okay, so what is the direction of inquiry here? Present we have the cases, that is the disease present, and controls, they are disease negative, and in both cases we go look backwards and look for the past exposure. Okay, so basically this disease this case control starts with the disease, and then we determine the presence or absence of the exposure. Okay, so basic design is we have to select the cases. These are the individuals who have the disease in the population. So we'll take a population. In the population we'll look for the cases or the disease person. That becomes your step one. The step two, selecting the control. Okay, actually we feel that selecting the cases is difficult. No, it's mainly the selecting the controls is very difficult in the case control study, because for case we have the operational case definition. Once the case is defined operationally, whosoever will fulfill the criteria we will include. But for selecting the control, these controls should be matched with the composition of the case group. Okay, so there should be equal number of male, female, then there should not be any difference between the two. So both groups should be homogeneous. So you need to have the appropriate control. Okay, so that's not a very easy job. So individuals who do not have the disease, they form the control group. Okay, so that is the non-disease population. Then third step is measure the past exposure. So we go backward in the history, and in the disease patients, or in the cases or in the controls, we look for the exposure. Okay, for example, did the smoking 10 years ago increase the risk of hypertension today? So since 10 years, if the patient is, if this is the question, then we'll go back and look for the smoking. Okay, so we'll take out the cases of the hypertension, equal cases of non-hypertension, and we will go back to look for the smoking over a period of last 10 years. Okay, so most important rule here is that cases and controls must come from the same source population. Okay, so the population should be same. Okay, suppose you are taking some cases from male ward, then you cannot have a control group for with the female ward. Okay, it has to be same population. If we have got a mixed population in the cases, then you will have the mixed population in the control group also. So if controls are selected from a different population, then it is a selection bias. Okay, so this also can be asked as a SBA. Okay, so this is one of the most frequently tested concept in the examination. Okay, so you will have a 2 by 2 table, as we always find out the 2 by 2 table in the epidemiology, like patients who have the cases and who are the controls. Okay, and we'll look for the exposed, and we'll how many are exposed and how many are not exposed, okay, to the risk factor, that we are going to see. Okay, now we will measure the measure of association. Okay, so there is a measure. How we are going to calculate the association between the risk factor and the disease? So it is by the odds ratio. Remember, case control study, they will always ask about the odds ratio, because odds ratio can be measured in the cross-section studies also. It can be measured in the cohort studies also. But primarily, when it comes to the case control study, our primary aim is to calculate the odds ratio. Here you cannot calculate the incidence, you cannot calculate the relative risk in case control. Okay, you will only get the odds ratio. So case control studies use odds ratio, not the relative risk, not the risk ratio. What is the reason? Because we start with the existing disease, we start with the outcome. Therefore incidence cannot be calculated. For incidence to have, it is the presence of new case, while here the disease has already happened. So we cannot calculate the incidence in the case control study. Okay, so what is the formula for the odds ratio? It is AD upon BC. Okay, so these are the disease cases and these are the non-disease, and this is the exposure status, exposed and unexposed, and we formulate this A, B, C, D, that is the 2 by 2 table, and then we'll calculate the number of cases with exposure in the disease, that is exposed cases are A upon C. Okay, so these number of cases with exposure divided by number of cases without exposure in the case group. Okay, in the disease population, then we'll that is the then we'll find out the odds of exposure in the control group, non-disease population. Okay, so exposed divided by unexposed. Okay, so that will be B upon D. Then odds ratio will be calculated. Odds of exposed in the cases divided by odds of exposure in the controls. That is A upon C divided by B upon D equal to AD into BC. That is the formula for the odds ratio, they very frequently asked. Okay, so why we cannot calculate the relative risk? Relative risk requires new cases. Okay, so we are not dealing with the new cases in the case control. So in case control studies, number of cases is chosen by the investigator. Number of controls is chosen by the investigator. Okay, so therefore disease frequency is artificially fixed. Okay, so incidence cannot be calculated, risk cannot be calculated, relative risk cannot be calculated, odds ratio can be calculated, because it is the investigator who fixes actually the number of cases in the case group, number of controls in the control group. Okay, so how do we interpret the odds ratio? Odds equal to 1, that means no association. Okay, because exposed as well as non-exposed group has got same frequency. Okay, so odds ratio of 1 has got no association. Odds ratio more than 1, exposure is associated with the increased disease. Odds ratio less than 1, exposure is protective. Okay, what is the meaning of odds ratio of 4? It means people exposed have 4 times higher odds of the disease. Okay, what is the meaning of odds ratio of 0.5? That means people exposed have half the odds of the disease. Okay, so disease odds ratio versus exposure odds ratio. So these are the two different concepts, odds ratio and exposure odds ratio. Okay, so disease odds ratio is there and the exposure odds ratio is also there. Now, what is the meaning of disease odds ratio? It is the odds of exposure among the diseased individuals compared with the non-diseased individuals. Okay, so disease odds ratio, here we are taking the disease population and we are finding the odds of exposure among the disease compared with the non-disease individual. When we talk about exposure odds means odds of the disease among exposed individuals compared with the unexposed individuals. Okay, so when we talk about exposure odds, we are talking about the odds of the disease among the exposed individuals, okay, compared with the unexposed individuals. But actually speaking, we just talk about mainly the odds ratio in this case control study. So both are denoted by AD upon BC, therefore interpretation remains identical. Okay, so advantages of the case control study: first thing, it is fast, no follow-up is required, then it is very cheap, less expensive than the cohort study. And the most important is it is useful for the rare disease. Okay, while cohort study is useful when the exposure is rare, while case control study is useful when the outcome is rare. Okay, so it is excellent for studying ovarian cancer, endometrial cancer, ectopic pregnancy, rare congenital disorders, etc. Can the case control study multiple exposures? Like cervical cancer can evaluate HPV infection, smoking, immunosuppression, sexual behavior within the same study. Okay, so it can be done. Okay, then what are the disadvantages with the case control study? Cases remember exposures better than the controls. Okay, because cases have got an outcome, and most of the time it is a disease or the bad outcome. So they always remember the past thing, why this has happened. Okay, and while the control group will be casual about the exposure. Okay, even they might have been exposed, but they may not remember it. Okay, so for example, mother of a malformed fetus will remember each and every drug she has taken during the pregnancy, while the mother who had got a normal baby, she may not remember everything. Okay, so that is what is the recall bias. Okay, so bias are very common with the case control study. Okay, then selection bias, control may not represent the source population, so it is happening at the level of the investigator. Okay, so other is it cannot calculate the incidence, so no disease rates is available. It cannot calculate the relative risk directly. Okay, it will give you only the odds ratio. This is the case control study flow chart. So it shows that there is a population in which we will select the cases. We'll also select the matched controls. These controls are matched with the cases. Okay, and then we'll look for the past exposure and we'll calculate the odds ratio. Okay, so when you perform the study, this is the population. Then among the population, it has got a disease population as well as the control population, and these are the two groups which we will go retrospectively. Okay, we'll go in a backward direction and we look for exposure in both the groups. Okay, so exposure present, exposure absent, exposure present in the non-disease population, exposure unexposed to the risk factors in the control population. Okay, now if we compare this case control study with the cohort study, then what we will find, the cohort study begins with the exposure. It is a going forward direction, the case cohort study, and it will give you the incidence. While case control study, it begins with the outcome, it goes in a backward direction, and the outcome basically the outcome has already happened. So outcome measure is existing disease. Okay, so can the case control give you the relative risk? No, case control cannot give you the relative risk, while cohort will give you the relative risk. Odds ratio is possible with the cohort as well as case control, but odds ratio we don't take much into account in the cohort. We mainly take into account case control. Okay, but it is possible in the cohort also. Okay, cohort is best suitable when the exposure is rare, while case control is not suitable. Case control is more suitable when the outcome or the disease is rare, while cohort is not suitable there. Okay, for cohort, time required is long, while case control can be performed in a short time. Cohorts are expensive, while case control studies are relatively cheap. Okay, so when you compare with this case control study along with the cross sectional, so basically case control will start with the disease, while in cross section both will be present simultaneously. Okay, then exposure is measured in the past. Okay, while cross sectional you study there and there in that section only. Okay, that time only you measure the exposure. Then temporal sequence is not very clear. It is usually clear in the case control, while it is not clear in the cross section study. Okay, then odds ratio can be calculated in the both. Relative risk and incidence both cannot calculate. Neither the case control nor the cross-sectional study will give you the incidence as well as relative risk, but odds ratio will be given by both. Okay. Then from examination point of view, the cohort begins with the exposure. We'll think about the relative risk. Case control starts with the disease. We'll think about the odds ratio. While cross-sectional study is a snapshot, we will think about odds ratio can be calculated. While RCT, here the exposure is assigned by the researcher, and we will think about the relative risk. Here relative risk can be calculated in the RCT also. So cohort, it goes from exposure to the disease in a forward direction, while case control goes from disease to the past exposure in the backward direction. While cross-sectional is a snapshot, it studies the exposure as well as disease in a together way. Okay. RCT, here the investigator will assign the exposure. So just one line summary for the case control. So case control study is an analytical observational study that starts with the disease and non-disease individuals, look backward for previous exposure, and uses the odds ratio as the principal measure of association. Okay, so please keep in mind it measures the odds ratio as a principal measure of the association. Okay, so direction is backward. We select the population with having the disease and non-disease population, and we look for the exposure in both the groups. Okay, so here we finish with the case control study. We have few questions, doctor. Can you please read these questions?
Yes, sir. A researcher identifies 150 women with endometrial cancer and women without endometrial cancer. Previous exposure to tamoxifen therapy is assessed from hospital records. Which study design is being used? Cohort study, cross-sectional, RCT, case control, ecological study. Sir, case control study.
Justify case control.
Sir, because we are taking disease and the non-diseased one, endometrial cancer and without.
And we are going backward. We are going backward because even cross-sectional will have this, no? But yes, we are looking for the exposure. Okay, is assessed from the hospital records. Okay, that is the most important thing. So why not cross-sectional? Okay, so case control study. Participants are selected based on the disease status, case and control, and past exposure is then determined retrospectively. This is the defining feature of case control study. Next.
Which measure of association is primarily calculated in a case control study? Relative risk, risk difference, incidence rate, odds ratio, attributable risk. Sir, odds ratio.
Yes. So case control study, we calculate the odds ratio because the investigator starts with the diseased and non-diseased individuals. Incidence cannot be directly measured. Therefore, relative risk cannot usually be calculated, and odds ratio is the appropriate measure. Okay, next.
A study compares 120 women with ovarian cancer and 120 healthy controls. 120 women with ovarian cancer and 120 healthy controls regarding prior use of fertility drugs. The major advantage of this study design is can calculate the incidence best for rare diseases, eliminates the confounding, measures the prevalence, requires small sample only for common diseases. So option B, best for rare diseases.
A study. So the major advantage of this study design, because this is a case control study, the advantage with the case control is that it is best for the rare diseases. Okay. So case control studies are particularly useful for studying uncommon outcomes because investigators deliberately recruit cases. Next.
Which of the following cannot be directly determined from a case control study? Odds ratio, case control study. Which of the following cannot be directly determined from a case control study? Odds ratio, association between exposure and disease, relative risk, exposure frequency among cases, exposure frequency among controls. Sir, option C, relative risk.
Yes, the relative risk you cannot calculate from the case control. Since the total population at the risk is unknown, incidence cannot be calculated and therefore relative risk cannot be determined. Next.
A researcher wishes to investigate whether maternal obesity increases the risk of preeclampsia. She recruits women with preeclampsia and women without preeclampsia and reviews their booking records for BMI. This study is cohort study, cross-sectional study, ecological study, case control study, clinical trials. Sir, option D, case control study.
Yes. So we are looking for the exposure. We are taking the outcome and then we are going to look for the exposure. So here selection is based on the outcome, preeclampsia, followed by retrospective assessment of the exposure, that is obesity. Okay. Now we have got a 2x2 table. Okay. So here yes, these are the cases with previous OC use and these are the cases without OC use in the past, and these are the cases and these are the controls. Now what is the odds ratio? What is the formula for odds ratio?
AB AC divided AD divided by BC.
A
B A into
A,
D divided.
yeah. A into D divided by B into C. So how will you calculate?
This is disease divided by control. So the table has been flipped, sir.
Yeah, even if you put outcome here, the calculation will always remain same here. Even if you put the cases up and previous OCUs, it will have the same thing. So what is the odds ratio here?
12, 12.
How come 12? It should be 6, no? 6. AD upon BC. 80 into 60 divided by 20 into 40. Okay.
40.
So it will be
yes, 6.
6. Okay. Women with previous OCUs have 6 times the odds of developing the disease. Next.
Which type of bias is particularly common in case control studies? Lead time bias, length time bias, recall bias, Horton effect, performance bias, recall bias, sir, option C.
Yes, that we discussed. Recall bias is common because cases often remember previous exposure better than controls, introducing differential misclassification. A mother of a child with congenital anomaly may more carefully recall medication exposure during the pregnancy. Next.
Which statement regarding case control studies is true? Exposure is allocated by the investigator. Disease-free individuals are followed over time. Subjects are selected according to disease status. Disease incidence can be directly measured. Relative risk is the preferred measure. Sir, exposure is allocated by the sir. Option A and C both are right. Subjects are selected according to disease status. Exposure is allocated by the investigator. Sir, option A.
No, it is going to subject. The primary in case control is selection of the case. Okay, subjects are selected according to the disease. That is the main thing. No, cases already have the disease, while controls do not. Exposure history is then assessed retrospectively. Next.
A disease has an incidence of 1 per 1 lakh population. Which study design will be most efficient? A disease has an incidence of 1 per 1 lakh population. Which study design will
So
be
is it
most
a common disease or rare disease?
rare disease?
Okay. So what type of study design we can select?
For rare diseases, better is case control study.
Yes. And when the exposure is rare, go for cohort. Okay.
Yes,
So
sir.
answer is E, case control study. Rare diseases require enormous cohort population to obtain sufficient cases. Case control studies deliberately recruit affected individuals and are therefore ideal. Next.
Which one of the following best summarizes a case control study? A start with exposure and moves to disease. Start with exposure and moves to disease. Start with disease and looks backward for exposure. Measures prevalence at one point in a time. Randomizes participants to intervention. Measures incidence prospectively. Option B starts with disease and looks backward for exposure.
Yes. So case control study goes in a backward direction. It starts with the disease and look backward for exposure. Okay. So from case to the cause. Okay. Start with the case, then look backward for the possible cause or the exposure. So take home message is case control study is an observational study. Direction is from disease to the exposure. Selection is based on the outcome. It is usually retrospective. It is best for rare diseases. Multiple exposures can be found out. Incidence cannot be calculated. Relative risk cannot be calculated. Odds ratio will be calculated. Common bias is a recall bias, but it is a cheap and quick study design. Okay, case control study. Okay, so cases control study start with the disease, look backward for the exposure, and calculate the odds ratio. So that finishes the topic of case control study. Thank you.